What happened when I told my hospital director I was leaving bedside nursing? Well, first confusion, then she asked for my number because she wanted to follow me. I'll tell you exactly why in this video and how you can make the same move she's desperate to make. Hey there, welcome back to the channel. If you're new here, I help clinical professionals leverage their healthcare experience to land amazing careers in digital health without the burnout, night shifts, or chaos. When I finally decided to leave bedside nursing after 5 years, I was honestly terrified to tell my boss. Would she see it as a betrayal? Would I burn a bridge? I practiced what I'd said for days. I'd practice what I'd say for days. But her reaction completely surprised me. First came confusion, digital health, what exactly would you do there? Then genuine curiosity as I explained to her my new role. And finally, she actually asked for my contact info so she could learn more about potentially making the same jump herself. That's when it hit me. Even hospital leadership is feeling the strain of broken healthcare systems. Everyone, from new graduates to veteran clinicians to the C-suite, is looking for a way to use their expertise without the crushing burnout. Let me tell you what nobody in nursing or medical school ever mentions. Your understanding of healthcare from the inside, the workflows, the terminology, the challenges, this knowledge is incredibly valuable outside of the traditional patient care route. Digital health companies, health tech startups, and healthcare software firms are desperately seeking clinical professionals. Why? Because they need people who understand healthcare realities, not just theories. Think about it. How many times have you used a clunky electronic health record and thought, whoever designed this has clearly never worked a shift in their life? That's exactly the problem these companies are trying to solve. They have plenty of technical experts who can build software, but they need people like you who understand what exactly works in clinical settings. Let me walk you through some specific roles that are perfect for nurses, doctors, and other clinicians looking to make this kind of transition. First, project managers. Healthcare projects need people who understand both the clinical workflows and basic project management principles. Your ability to coordinate complex patient care translates perfectly to coordinating digital health initiatives. Second, analysts. You're already analyzing patient data and clinical situations every day. As a clinical analyst, you'd apply these same skills to improve healthcare systems that impact thousands. Third, testing specialists. Who better to test if a healthcare application works than someone who's actually provided healthcare? Your insider knowledge helps you identify problems before they reach actual users. Fourth, trainers. Teaching colleagues how to use new systems effectively is critical in healthcare IT. Your ability to explain complex concepts in simple terms makes you perfect for this role. And fifth, team leaders. Leading teams that bridge the gap between technical and clinical worlds requires someone who speaks both languages. Now, let's talk about what this career change actually looks like day to day. No more physical exhaustion from 12-hour shifts on your feet. No more missed family events because you're working nights, weekends, and holidays. No more exposure to workplace violence or infectious diseases. Instead, many digital health professionals enjoy normal, predictable Monday to Friday kind of schedules, the ability to work remotely or at least part-time, salaries that match or exceed clinical roles, career advancement that doesn't require additional degrees, using your healthcare knowledge in new and innovative ways. I remember my first week in digital health, I had meetings where people genuinely wanted my clinical input. My ideas weren't just heard, they were valued and implemented. I realized I was still helping patients, just thousands at a time instead of one at a time. Now, I know what you're thinking. This sounds great, but I don't have technical skills. Here's the truth. The technical aspects can be learned in months through targeted courses and training. But your clinical experience? That takes years of frontline experience to develop. That's why companies value it so highly. Many of my coaching clients start with zero technical background, and within 6 to 8 weeks of focused learning, they've developed enough technical understanding to land their first digital health role. The learning curve isn't nearly as steep as most people fear, and the digital transformation of healthcare is creating unprecedented demand for clinical professionals who can bridge both worlds. This isn't a small trend. It's a fundamental shift in how healthcare operates. With the explosion of telehealth, remote monitoring, AI in healthcare, and digital health apps, the industry needs your perspective more than ever. Remember my hospital director? Well, 6 months after our conversation, she also made the leap to digital health. I told her, welcome to the dark side. We have cookies. Now she leads implementation teams for a major healthcare software company, working remotely, making more money, and feeling reinvigorated about her career in healthcare. So here's what I want you to take away from this video. Your clinical experience isn't just valuable at the bedside. It's your competitive advantage in digital health. You don't have to choose between using your healthcare expertise and having the lifestyle you deserve. Digital health offers a path to do both. If you're feeling the pull to explore this path, I've created a free digital health career roadmap specifically for clinical professionals. It breaks down exactly which roles match your background, what skills you need to develop, and how to position yourself for these opportunities. Click the link in the description to download it now. Go find me over on Instagram and give me a direct message. And if you're serious about making this transition, check out my coaching program, where I provide step-by-step guidance to help clinicians land their dream digital health roles. Let me know in the comments what's currently holding you back from exploring digital health careers, and I personally will read every comment and respond to as many as I can. If this video helped you see new possibilities for your healthcare career, give it a thumbs up and subscribe for more insights on transitioning from clinical roles to digital health. Hit that notification bell so you don't miss my next video. And remember, healthcare needs your expertise, just in a different way than you might have originally planned. I'll see you in the next one.